So welcome everybody to the final 2024 Coffee and Conversation speaker. Hopefully you've been enjoying this series. I know some of you haven't been always able to be here live, but have been watching videos. And if you have any questions on, for follow-up after watching those videos, let us know and we can connect you with the speakers as well. But for our last conversation, we're excited to welcome Luis Parra, who is an assistant professor at the University of Michigan School of Nursing. I don't think many of you get a chance to interact with him because he teaches in the undergrad program and then we'll be starting in the PhD program. So this is a great opportunity to learn a little bit more about some of the different work happening at the School of Nursing. And Dr. Parra, approaches science and pedagogy with an intersectional anti-racist and anti-heterosexist perspective. He applies developmental, social, ecological, critical race, queer, and intersectionality theories to investigate how people's racist and heterosexist beliefs, attitudes, and behaviors affect behavioral and mental health among marginalized populations. His work emphasizes how multiple intersecting forms of discrimination impair biopsychosocial adjustment among ethnically and racially diverse lesbian, gay, bisexual, transgender, and queer adolescents and emerging adults. And Dr. Parra has some unique collaborations that he came to the University of Michigan with, and so is going to speak a bit about his work as well as developing those collaborations. As always, please feel free to use the chat for questions throughout, and then we will have time for Q&A and conversation at the end. I will turn it over to you, Dr. Parra.
Thank you. Well, I'm super thrilled for the opportunity to come chat with you this morning and share some of my work and probably start a little, and I'd like to start with how I got in collaborating at an international level and really starting to think about impacts of different circumstances and contexts that LGBTQ youth develop. And like Michelle mentioned, I have a really big biopsychosocial approach to studying health disparities among LGBTQ and people of color. But one of the big things for me was understanding more of something we know very much about LGBTQ populations, especially adolescents, when they come out of the closet or disclose their sexual orientation, or their families find out about their sexual orientation. Sometimes that experience can be really traumatizing and really negative, and oftentimes youth get ejected from their homes, so they get kicked out into the streets because of their sexual orientation. And that was something I was learning a lot through my entire career and reading a lot of these narratives and stories in my own research, seeing how experiences of family rejection often led to homelessness. And even though my approach has always been understanding these basic components of understanding the relationship between the mind, the brain, the body in social contexts, it wasn't until later in my career that I started really thinking about, well, what's the implication of this work? Why is it important? And for me, that really pushed me to ask questions about what happens after the rejection happens. But that was just one of my big questions. But how did I come into doing this work at a global and international level? Well, in 2018, I was a graduate student and I was funded by the National Science Foundation. I had a fellowship that paid for my PhD for most of it. And because I was an NSF fellow, I was able to apply for a global worldwide opportunity to go do research at another country up to a year. And I chose the Netherlands. And one of my big reasons there is, from my big American perspective, I thought that the Netherlands was a really progressive country. They were the first country in the United States in the world to approve same-sex marriages. So I really wanted to understand what that type of social political accepting climate would do for the health of LGBTQ people. And I get there and realize that even though they have these progressive policies, LGBTQ people continue to be very disempowered. They continue to be discriminated, and homophobia is something that's really prevalent still within that country. And on top of that, the intersection of being an immigrant or a person of color in the Netherlands also looks really different, where the queer rights of Dutch white appearing persons are very progressive. Those laws don't necessarily trickle down, and protections and laws don't trickle down to benefit the lives of POC, people of color. Now, during this particular experience in the Netherlands, I met with Dr. Monica Lopez Lopez, who is the person who I now collaborate with. I've been collaborating with the past 5 years in this particular concept of understanding LGBTQ youth in the child care welfare system. And here, I want to introduce our team. And we get to work with all these amazing youth policy organizers. We built collaborations with individuals and organizations and government agencies in Spain and in Groningen, in the Netherlands, and Amsterdam. And we use a very important participatory research lens, where we not only work with other colleagues and different expertise, with individuals in administering care in the social welfare system, administrators of policies that will fund programs within the child welfare system, but we also work with the youth themselves, the people who are in residential home care. And a lot of this stems from us really honoring this community partnership component, where youth come in and tell us their narratives. We hear them. We ask them, what are the things that you want to see change to make your lives better while you're in the child care system? And together we co-create research questions, we co-create initiatives for policy changes, and we also empower these youth through a lot of trainings, through a lot of advocacy work, so that they're able to better be informed about what their rights are. And speaking about rights, something that in my work in Europe has been really prevalent is the many policies and laws that are there to protect children. And we have them in the US, and we ascribe to the many of these policies, but there's something about they're more enacted and really upheld in Europe more so than I see in the US. And with that, it's the protecting children, and it's going to be one of the main emphasis in a lot of our work and how we position ourselves to do this research to agencies is by prioritizing many of these policies that are available and enacted at the ground level. So with that, I just want to go ahead and start with giving you a few key words for this presentation. So I use LGBTQIA+, and this is really to include lesbian, gay, bi, trans, queer, and sometimes the Q here starts for questioning, which is another category within the sexual minority population. And asexual, and the plus really represents the many other sexualities that typically get excluded from a lot of these acronyms because they can become longer and longer. I do use the term queer as a umbrella term to really capture the flexibility and fluidity of sexual minority identities. And of course, we talk about sexual orientation, which is someone's attraction to another person. And of course, if it's and gender identity being very different, where people identify as either men, women, gender non-binary, gender queer. And of course, the child welfare systems, I use this as a general term, but we typically also focus a lot in group homes that are more common in Europe relative to here in the US. And of course, residential care, that's what I meant for some individuals. So here I'm going to be talking about two of the projects that I've been really involved with in the past 5 years and working with our colleagues in the Netherlands and in Spain. So as I mentioned, we use a community-based participatory method where we all work together with youth, with community leaders, community organizations, and to try to understand what the priorities are for these populations and for these groups of people. And we really try to assess what are the capacities of these institutions to provide equitable care and services to these queer youth in their foster care system. And we do this by using a mixed methods approach where we use interview with the youth and the professionals. And we do a lot of online surveys as well, just so we can able to understand and measure biases from individuals without us being in the room and biasing their responses. Because we really want to capture and understand in these particular programs, like what is the overall attitude and belief system of these organizations, what is their knowledge base and understanding the content of LGBTQ in the populations. And we do this also by taking an anti-oppressive approach. For example, we don't want to come into these projects thinking of a risk perspective, thinking that these youth are vulnerable, that these youth are at risk for being marginalized even more. Even those are realities and the truth about these populations, but we really try to take on a more joy and queer joy perspective, meaning trying to address this deficit. That even individuals who experience this type of adversity or these really home displacements, that they're able to be resistant with the support of community and interpersonal relationships. And we want to understand how these youth actually see the world through those lenses. And this is going to help us a lot to build interventions and how to better support them while they're in this particular environment. We also think about ethics of care, like in terms of involving the youth in our actual participatory methods, how it's an ongoing consent with these youth where we consent them into the study. But every single time we do a focus group or an interview, and even after the interviews have been conducted, we provide our WhatsApp numbers. We're available via email. We are able to be available to them through social media in case they have any questions, or they say they participated 6 months ago and they suddenly felt like, hey, I have these other thoughts. We maintain those open channels of communication to be able to provide care for these youth over time. So one of the big findings that we have from these particular projects that came from doing the literature reviews, working with a dozen PhD students invested in these topics, is that we know that LGBTQIA plus youth are overrepresented in child protection in the juvenile justice system and homeless serving institutions. And when we think about this, why is this significant, right? Because when we think of the general population and global estimates of LGBTQ people in the population, it's estimated that it's about 10 to 12% of individuals worldwide identify as LGBTQ or are a sexual minority. So when we're already talking about a smaller subsample of the population, and then we see that that smaller subsample of the population is actually represented in a system in a juvenile system or a child protection system, we really think about how a lot of these systems and these home placements are designed for general populations, for general adolescents, and assumed to be homogeneous. So many of these overrepresented youth in these in these institutions or receiving care are actually not well. Those places are not designed for these youth. So we get to see many students or many of these youth suffering in silence. This is a big theme from a lot of our analyses, that they experience microaggressions, they experience, and I'm going to be tapping into those a little bit more. But we know that there's not adequate care, and that individuals are resident home foster carers are actually not trained to foster and provide care for an LGBTQ. So this is something that has really come up in a big topic of conversation, really making this more of a important point for us to consider when we think about these youth in childcare and child welfare systems. And one of the things we know from all of our interviews too, and from our systematic analyses that we've conducted, is that there's this overrepresentation of LGBTQ is primarily due to families' negative responses to their children's sexual orientation and gender identity expression. And one of the key findings from this particular aspect is that when we talk to professionals about these topics, many of the professionals tell us that no, their youth were ejected from their homes for other reasons other than the LGBTQ identity. And when we ask them, well, did you ask that? They're like, no, we don't collect SOGI data. So there are a lot of assumptions here that professionals downplay the reasons for why youth are in foster care, and it really never gets addressed that there's a sexuality related, it's sexual orientation related in terms of the family rejection. But one of the things that we do know is that by us not understanding why families are rejecting or asking what the reason for why LGBTQ were rejected from their homes, and not addressing this homophobia that is embedded within the family system, we don't get to really then target interventions to work with those families of origin, to be able to help them understand their children's sexual orientation and gender identity expression. So here in our conversations with in the Netherlands and Spain, we really try to train the professionals now to be able to inquire further and asking these questions about sexuality related family rejection. Now, why is family rejection a really important aspect for us? It's because we know that family rejection has really profound health outcomes in the long run. We know that family rejection is associated with onset of suicidal ideation and substance use. We know that it's heavily correlated over time with depressive symptoms and major depression disorders. And we know that it's also associated with many other chronic health conditions. So we know that family is a really, really critical and important component. And often in the child welfare system, the family of origin is not really included in the decision-making of those youth placements over time. But one of the things here we know, at least from my developmental research, is that over time, families become more accepting and end up supporting their youth. So I think this is like a really critical aspect that we, in our field, particularly with LGBTQ youth and out-of-place home placements, that we really have to understand and be center of the family to be a key component in the decision-making and development of that youth. So here's another big topic and theme that has come up through a lot of our work is that LGBTQ youth are an invisibilized group in the child welfare system. And what we mean by that is, again, that when it comes to doing these intakes by care professionals, as soon as the youth is going to enter the child welfare system for whatever reasons, and I tapped into this, we don't ask about sexual orientation. In some of the interviews we've done in Spain, we've asked how many of the youth in your house or the group home are LGBTQ, and they say no one is. And we're like, well, how do you know no one is? And by then we already know that there's a few of them in the home because we've interviewed them, and they just say that they don't ask. And again, we ask reasons for why not asking, and a lot of time it's taboo is very much a topic that and misconceptions about adolescents in terms of like, well, that's too much of a sensitive question. We're going to invade their privacy. And a lot of the time, when we talk to the youth tell us like, well, they don't even ask me. And if I tell them I am, they tell me not to talk about it and to keep it quiet. And we're triangulating this information. And a lot of what we're finding is that it's just that the care professionals and the social welfare system intake assessments, the assessors are not well trained or versed in LGBTQ health and language and culture, and they find asking those questions to be difficult for them rather than difficult for the child or the adolescent to answer. And of course, we get here to the child welfare system is not always a safe space for LGBTQIA youth. And what I mean here is that I mentioned already some of this is that this lack of training from care professionals and also other youth who are living in these residential homes who are not a part of the LGBTQ community have a prevalence of negative stereotypes and about LGBTQ youth, and this is manifested through various discriminatory practices. So we know that there's rejection by peers after they find out that one of their youth is LGBTQIA. There's a big they invisibilize the youth. They ignore them completely. They shun them out from conversations. They refuse to share rooms because a lot of in residential homes, there's 2 beds per bedroom, and a lot of the facilities that we visit and work with. So the straight adolescents and youth asked to be moved to another room. They refuse to change in front of their LGBTQI peers. And there's also a lot of bullying that happens within these homes, like microaggressions and a lot of just direct violence and disgust that gets manifested and displayed by these straight youth. We also have these concepts where we're learning that LGBTQ are over-sexualized in these contexts as well. That one of the big assumptions that many youth and peers in those classes find is making fun of lesbian or bisexual women. They make a lot of sexual innuendos and really think that really hone in on its over promiscuity that's assumed to be part of the LGBT community. And we see a lot of sexual harassment in this way by peers of other LGBTQ youth in these spaces. And we also see this by professionals using sexually offensive abusive terminology toward a lot of the youth, accusing them of always being hypersexual, accusing them of engaging in sexual misconduct. And this is something that the LGBTQ, when they share this with us, find very painful. And one of the things that we are realizing, and we really emphasize back to the professionals and the actual policymakers and the government agencies, is like we need to be able to provide a safe space for these youth. And the way we would be able to do that is by really, again, training individuals to understand their own biases, to get more education around sexual orientation and gender expression and identity. And really then going back and having them honor that the roles are to be a caretaker and to provide a safe space for LGBTQ youth and all youth to feel able to develop naturally in their own environments. Now, we talk a lot about sexuality in these conversations because, as we know, I mean, adolescence is a developmental period in everyone's life where it's the initiation of sexual attraction, getting to know your own body, getting to know in relation to other people, exploring multiple identities, including your sexual orientation and identity, or even your racial ethnic identity becomes a part of exploration and formation, and really tying into who you are and values. And this is something that often gets ignored by these professionals. And them not understanding the context, but rather operating on a moment-to-moment basis of like, this is what we need to do now to get through the next day, rather than really thinking about the development of these youth over time. We see that these spaces, these group homes in Spain and in the Netherlands are actually even more unsafe for non-binary youth. And we see this reflected a lot from the majority of our participants and our partners who tell us that they're often not allowed to express their true gender, who they are. Professionals and youth refuse to use their chosen social name. and continue to dead name them. That is, these youth are born to and ascribe the gender at birth based on their sexual characteristics. They're giving their name at birth, and eventually in their social transition over time, they change their name to something else, and that's what they want to be honored as. And professionals refuse that social change. So again, professionals really serve here to oppress the individual from expressing their true gender identity. And in many cases, we see trans youth who they have long hair, they want to transition to their male gender, and they're refused to cut their hair. They're not allowed to wear clothes that expresses their true gender. And so here we become to see that not only are these youth a sexual minority, but they're also a gender minority. And we're starting to notice that there's an intersection there between sexual orientation and gender, and how this is more of a compounded stressor. And many of our trans youth have reported major depression. Many of them are seeing counseling services, not just for their transition, but also for challenging the toxic environment that they're in these particular group homes. A big reality here is that these experiences in these spaces are meant to be a shelter and a haven for these youth after being ejected from their home. But as we've seen here, they're not always that. And some of the homes that we've worked with have been very, very oppressive with the care professionals that have been in charge of these youth and making sure caring for their well-being, that we did lose a youth to suicide during our interventions. No, these are just the big realities of working with populations that are often marginalized, who are pushed in a corner and see no way out. They've been rejected by their families, they've been rejected by society, they've been rejected now by these new homes. And as a care professional and as someone as a researcher, we really have a responsibility to make these conversations more vivid and push really hard for systemic change among these institutions. Now, we also see, I mentioned intersectionality at gender and sexual orientation, being a gay trans man, for example. But we also have many youth in systems that are migrants or from different ethnic cultures in Spain and in the Netherlands. In the Netherlands, we have many Moroccan youth that migrate to the Netherlands and are placed in care. And what we have in Spain is, Romani individuals, or we sometimes call themselves gypsies. And we see many of these youth in foster care systems as well. And in their experience at the intersections of being from an ethnic minority and being a sexual minority are also quite, they're very strong lived experiences that we've been capturing. In some cases, professionals imply that they're disgusting. In some Romani girls, for example, have very long hair and have very different ways of speaking and expressing themselves based on their cultural heritage. And a lot of the Spanish caretakers try to force them to unlearn their accents, try to have them cut their hair so they could assimilate more to a Spanish culture. And we see this to be a really, again, profound negative experience for these youth, where they're being denied their own identities and their own cultural heritage and backgrounds. And these systems are actually not supporting that development, but rather oppressing it. So here, just really just want to let you know how all of this is really dangerous for some of these youth. And then they say it themselves with their own words, that there's a lot of conflict, and these individuals consistently feel discriminated against and like they don't belong. I mean, and one of the big things too, like from a humanity level and the way I think about life in general is that we're all social creatures. We're all meant to build social bonds. This is in our biology, the way we're raised for most of us, majority of individuals. So denying a person their ability to form safe bonds with others is another form of oppression, and thinking about how these systems are consistently failing these youth from being part of a family outside of their families of origin. So now here we have like, these are the negative experiences that we've seen within the childcare system. And one of the things we know about these, in Spain in particular, which I've been more focused there because I speak Spanish and I'm able to really interact and have more of a stronger role in understanding the community and organizing, communicating, working with others, is that in Spain, especially in the northern area in Cantabria, these group homes are actually, the government thought that would be a good idea to buy these big mansions in the middle of the wealthiest areas of this region of Spain so that they can house these youth into these big homes. And what we end up finding is that these youth in those communities end up experiencing a lot of discrimination. And it looks really differently. For example, youth live in these wealthy areas now, and the neighbors around them discriminate them because they are part of the welfare system. These youth then get harassed that when they leave these homes to go to their work or to the universities, to their high schools, and they get discriminated against in the buses and the public transportation system for being LGBTQ. Some of these youth have jobs after they go to work after college, after their high school classes, and they experience work-based sexual harassment by other employees. And here's one of the big things that we are really working with the government in Cantabria for them to realize and understand, like, how do we then not just protect these youth in the homes, but what can we do at the community level to be able to protect and create more of a safe space for these youth to be able to function? Because one of the big goals about youth entering the social welfare system, and a big goal of the care providers, is to help them learn basic living skills so that they can transition into young adulthood and an independent life. And when the system itself is not preparing them, but we're also like thinking of the geographical location, and especially in northern Spain, which happens to be a little bit more conservative, more right-wing, that these youth are continuously going to be exposed to violence outside of the system. So how do we then prepare them to navigate those spaces outside of the child welfare system? Another thing we know here is that a lot of these youth experience violence out in the streets and are harassed a lot. And in this particular excerpt, youth were telling us that there was a time where someone was harassed really heavily, and then in a bus, and she and her girlfriend were really scared and got off, and that guy still chased them. And then the next time they saw that guy, they were around with more other friends, so she went over and punched the guy. So what happens now? They call the police, and she gets detained, and now she's part of the juvenile system, correction system. So now they're not only interfacing with child welfare protection systems, but now they have a criminal record. And this is all because they were defending themselves or felt like a sense of duty of being able to stand up for themselves after being wrongfully done or discriminated and harassed. And this is something we see very common in other conversations with youth, that they're in schools and they get bullied by 3 or 4 people, and then they stick up for themselves and they push someone or they shove someone, and the teachers and principals reprimand the LGBTQ youth for using violence, but the perpetrators never get any type of punishment or any type of repercussions for their actions. But one of the really cool things, again, we talk about these negative things, but one of our goals is to really empower these youth. It's like, you know, it really sucks that this is happening. And this is a true reality for many marginalized communities. There's these really big oppressive ideologies and behaviors that come with those negative stereotypes of different social groups. And it's something that we've seen in the fabrics of our country here in the US. We see it in multiple other countries. We see worldwide, there's places that criminalize homosexuality. And when we think about really giving that reality to the adolescents, which they already know because they've lived through these experiences, we also really try really hard to redirect them in understanding, like, well, okay, these things have happened. Well, what has gotten you through it? How do you think about these issues? How do you reframe them? How do you seek support with others? Even if you're not aware that you're doing something to promote your own well-being, like, let's talk about those experiences. So we know that these are just a lot of experts of experiences and how they do practice resistance to these transgressions. So we know that many youth are starting to become more empowered and actually correct someone when they're being homophobic or racist, that they stick up for themselves. We know that many youth work with their care professionals who they're like, you know what, they are lacking knowledge on LGBTQ issues. And it's not up to me to have to educate my care professional over and over and over again. But by doing so, I'm learning that I'm becoming more aware of who I am. And it makes me want to be part of something bigger. And this particular adolescent actually is helping us co-write a training manual for professionals. So we get to see a lot of like this empowerment here. We see a lot of microaggressions where, in its example here, the third example, where there was a TV series and there was a boy that identifies himself as non-binary, and a care professional just came in and said that this guy's mentally ill. And the youth resisted by saying, like, well, how can you say that? How do you know they're mentally ill? And so they're starting to really fight back and challenge some of these negative assumptions. And I think this is kind of where we start to see these bigger aspects of how do we then see an opportunity to build resistance, an opportunity to intervene and help youth use language and use really good resistance strategies to be able to protect themselves and correct and diverge negative stereotypes to something that really makes the individual question of why they're thinking this way. We see many efforts by youth trying to change the home culture. They initiate like little pride of movie nights where they watch a gay film. They involve everyone, some of them who work, buy cookies and invite other people to come. So we really get to see the efforts that these youth are trying to make to survive and to thrive even sometimes within these contexts. But yeah, I think that overall, like, I can tell you with a lot of certainty that in my time in Spain, and every time I go back, some of these youths are constantly emailing us, like, when's your next presentation? Can we co-present with you? And we've been able to maintain those relationships. And the beautiful thing about all of this is that we get a lot of support from some social care professionals. So what I mean by this is that even though I've been talking about child welfare professionals not being barely equipped or sensitive to LGBTQ issues, and even in some ways abusive to these youth, that there's like a handful of care professionals that actually really care for these youth and do everything they can to inform themselves about what are the ways that we can teach them, how can they support these youth. Um, and one of the things here we also know is that in the Spanish environment, in the social welfare program, there are few LGBTQ care professionals that have come up to us, but they're not out at work because of stigma and fear of being fired for their sexual orientation. But these actually are the caretakers that the youth love the most because they see themselves in an adult. They see a mentor. They see someone that can actually guide them through a lot of issues that they're encountering, and they feel more that there's more compassion. And the other thing we're noticing in these particular interactions is that these the LGBTQ care professionals are actually working with their straight care professional peers, and these homes are becoming a little bit more harmonious. Just in the ways that we see that when we interview youth in a particular home where there's a more positive LGBTQ representation, these youth are more likely to tell us more about their positive experiences rather than their negatives. So so with this, it's like I think it's a matter of one of the big challenges we have, of course, is how do we change ideologies and heterosexist beliefs and racist beliefs among populations to be able to make a change at the system level, to be able to improve the lives of these youth. And I think that one of the biggest important things, and one of our angles, I think it's going to be this aspect of community building and really honing in on the importance of social connection and how these spaces are meant to be able to provide a home, but also a place of safety for many of these youth who've been rejected by their homes. So in the coming years, we are actually going to be doing interventions with the actual care professionals. I'm in the process of analyzing a lot of the surveys that we've administered to really get a better idea of what are the attitudes and misconceptions that they have about LGBTQ populations. We've asked questions about what would you like to learn? And we're taking all that information to really create these workshops that we can go to and are working with one of the administrators in Cantabria, Spain, to be able to implement a requirement for new care professionals that part of the job is that they get at least a 8-hour training on LGBTQ health and care for a lot of the youth so that they're able to come into a system and be equipped with this knowledge to better provide care for these youth. Yeah, so I think those are our priorities for sure. The specific training to provide care and the policies that I mentioned that we're trying to change within the system. And we really want to make sure that we continue to do this work using an intersectionality perspective to really capture the multiple dimensions. And we continue our participatory research approaches so that the community can identify what the issues are and that we as trained professionals can help create strategies to support those efforts and analyze and make changes on the policy at the policy level. So with that, I want to open it up for questions. I know I presented a lot of information, some ups, some downs, and I'm happy to talk about the content. I'm happy to talk about engaging in policy work abroad, or how to even get started with those experiences.
Thank you so much. That was wonderful. I have quite a few questions, but I definitely want to hear from some of our other people online. And so please feel free to raise your hand, put a question in the chat. You can unmute if you have questions, but maybe to kick us off, Louise, talking a little bit about the policy focus. I know when I first met you, you said, I'm not sure if interventions are the goal, right? Like that you really wanted to kind of make change at this more macro policy level. So can you talk a little bit about, I guess, the relationships you need to drive policy and then how your collaborative team is going about that?
Yeah. So, when I started, it was more like, okay, how do we tackle these big um, governmental decisions that get made and what gets prioritized in policy? And one of the big things here was the importance of really understanding particularly in northern Spain and Cantabria region, it was to identify who are the governmental agencies and the head of those agencies. And think about what they're believing and identify them. And I say this because for us, it was really easy. That person, the head of the child welfare protection system, reached out to Monica and I about a potential collaboration because they were noticing that they were having a lot high incidence of LGBTQ youth in the child welfare system and that they didn't know how to support them. So this is a huge in because they already bought into the need. And whereas otherwise we would have had to go and talk to multiple people in administration that were tightly closed, related to the governmental agencies that were receiving funding from. Because a lot of it's a big network. It's like, who do you know? How well do you know them? And how do you chummy up to them so that you're able to go ahead and be in their spotlight so that you can get the attention to make your 5-minute pitch because they're so busy. So that was one of the big aspects of finding out who is the head of the social welfare program, and then identifying what is your relationship to the public healthcare system and what funding is available through those agencies. Of course, this is where we started really thinking like, well, how do we make a national level policy? And that would have taken a big consortium of everyone across Spain, and there are multiple regions, multiple governments. Different areas by region have either very conservative anti-LGBTQ perspectives or more liberal perspectives. And for us, we were at a time where Cantabria was very, they were governed by more of a leftist governor. So they were more pro-LGBTQ. They were more invested in social programs to be able to benefit the communities that they serve, or the people that represent in those communities. So we did this project with 15,000 euros. So, and of course, it paid for our participants' retention. We provided reports and we did all the work pro bono on our end. But we were able to use that money to really facilitate initiatives to promote the study, to be able to write in these pamphlets that we translated from Spanish to English, and be able to disseminate these for free to the community organizations. We, from all of these findings, we were able to just do like a 3-page brief to send to policymakers, because that's the other element of like, how do we take all this rich information and just give 3 or 4 sets of recommendations to be implemented. And but I think making that connection with the head of the social welfare system, connecting us to the public health service agency and the person that make a lot of the funding decisions there, was a key for us to be able to then prioritize LGBTQ education for incoming new hires who are care professionals. And that in itself was a huge feat. I mean, we had more ambitious goals that we wanted, like how do we get a space in the community for LGBTQ youth to go and have recreational time, all the demands that the youth were wanting. But ultimately the youth did also prioritize like, no, these people need to be educated because I'm tired of educating these professionals. But yeah, so I think I'm pretty young in my career. I mean, it's my second year as an assistant professor, and I've been doing research for almost a decade. But I still feel like I'm learning so much as we're entering these policy initiatives, because I mean, I'm someone that's like social justice. Like, I want the systems to change. They have to happen at the macro level. But we're realizing the true power and actually more at the macro level within community, that we're building these systems that we're now being able to expand a little bit to encompass like the social welfare system, that hopefully this starts building to something larger to make more of these systemic changes in that country in particular.
Thank you so much. I appreciated a few points. One is the small amount of money for the first project. And I think that happens frequently with global work is you have these larger visions and goals, but it's the little, it's little pieces. Like, what do you need to do first? And then the connections with the policymakers. When I was a postdoc, I actually worked with Jody Laurie in Liberia. And before we left the country, every time we would meet with the Minister of Health, and we often did only have, 5 or 10 minutes. It was very brief. But Dr. Laurie was very purposeful, and like, we will meet with them when we come in the country and when we leave the country to give them an update on what we're doing. And then they know your name and your face. And even as a postdoc, like that individual still knows my name at least, and so those connections are so important. And I appreciate you explaining how you kind of made them and how it happened to be somewhat serendipitous that there was an interest right on these issues as well.
Yeah. And also, coming into Spain, I paid a lot of attention of how people interacted there at the professional level, because there's also this social aspect of how do you engage in conversation, and it's like a dance. And there's a likability component that they have to like you as a person to trust you. And that's something I feel like I'm learning to do more and more. But I'm learning a lot from my friend Monica, who's like an expert in this international work. But it's something that it's a component that I think I never really thought about. How you present yourself, like being straight to the point with your arguments before and after. Like you said, meeting with the Minister of Health, like that was a super important meeting that we had on the first day. And then before we left, we also met with them again to give them the update of what we've done.
And the communication style, like people, I think we're very to the point here in the United States, and there's not always time for socializing and get to know, but depending on the culture, that is a component of those meetings, or bringing a gift or sharing a cup of coffee, or, whatever it might be. I think those are really important, like cultural considerations that aren't inherent unless you're paying attention.
If you ever do work in Spain, be ready for 5-hour meals. So, like, and dinners start at 8 p.m.
Yeah. So there's a great question here in the chat as well. I'll read it, but you could also see it if you click on the chat, Louise. So it says, it's from Hyjin, and it says, thank you for your presentation. I've heard that in South Korea, some individuals need gynecological care, but avoid visiting the hospital due to fear of stigma or having to discuss their sexual experiences during the consultation. How is the situation for these individuals in your country or in Spain where you're working? If it's not easy for them, what solutions could help address this issue? I'm asking these questions because she does research in women's health nursing. Hyjin is actually a international scholar here at University of Michigan and from South Korea.
This is in my understanding of the countries I work with, the US and Spain and the Netherlands, this is also a really common concern for many youth and people in particular, of not wanting to disclose their sexual orientation in different spaces. I can give you an American context, right, where we have multiple states in our country that don't provide gender affirming care. And that many people who are LGBTQ feel unsafe having to go for medical exams, because they might be misgendered, they might be experience discrimination or bias or be turned away from care, and if they disclose their sexual orientation. Now, that's really more prevalent in some places than others, and of course by regions. In Spain, we know we have the health system there actually has a really strong gender affirming care for the foster care youth that we work with. So they've been able to disclose their sexual orientation. They typically are accompanied by a care professional who knows their sexual orientation. But we also have those youth that have not discovered or really feel comfortable in disclosing their sexual orientation to others. Because the stigma and the stigma is a real thing. It exists. I can tell you that even in Michigan, like we have not very adequate LGBTQ healthcare practices. I think in our School of Nursing, we're working toward getting a certificate toward providing LGBTQ affirming care. But when we think about it, it's like it's 2024. Shouldn't we have that like a decade ago or even longer time ago? But it really speaks to the realities of many people that healthcare professionals are not always equipped to be sensitive to LGBTQ issues. Some countries and places do promote and do facilitate for discriminatory practices, and where the patient has very little control of whether how they're going to be treated. So what are some and the second part of this, so what are some solutions to address this, right? I think this is where I really talk about community connections within the LGBT community in terms of, I know, for example, anecdotally, I was going to a doctor here in Michigan that I didn't always feel safe with as a queer non-binary person. And I started talking to my friends who was like, where do you go get care? And then they identified a doctor who provides gender affirming care and that they feel really safe going there. And I was able to find adequate healthcare here. I think this is going to be where when we work with people in other countries, it's more like, well, where do your friends go get care? And do they feel safe there? And I think this is going to be one of those ways that community can actually provide a lot of resources in identifying those few care professionals that are actually really invested in providing healthcare to everyone or specializing even in LGBTQ individuals, but at the minimum that they at least provide care that treats people with dignity and respect. And I think that's something that can be hard to find, but I think this is where community resources become really important in navigating those spaces. I can't speak to South Korea in generally, but because I haven't worked in that country, but I think it would be really important then to understand or figure out what are the LGBTQ rights, what are some of the policies in place for these if they even exist, but also then working within those networks to be able to identify these spaces.
Thank you, Luis. And I would just add, I mean, I think there is we've done some work with university students, understanding their experiences of inappropriate, disrespectful, and coercive care. And there's a lot of kind of stigma and discrimination, sometimes based on sexual orientation or gender identity, but also intersecting with other characteristics such as race, ethnicity, even the zip code, like if they're seeing where people are coming from, honestly. And so we are looking at some interventions here for that and just thinking about training. I think there are some providers that certainly are kind of have more information, are better at providing gender affirming care, but just ensuring that every interaction isn't kind of traumatizing. So kind of thinking about more trauma informed care. And then the other thing we recognized is that patients often don't know how to report when they have interaction with a healthcare provider that isn't kind of trauma informed or is inappropriate or disrespectful or coercive. And so thinking about mechanisms for reporting that are more visible and easier for patients to find so that those behaviors can start to be addressed a little better. We found, I don't know if you've seen this at all, Luis, but we do patient satisfaction in the United States, right? And people are trying to put things in there, but the way that those surveys are actually reviewed is they're looking for keywords. And so if you put kind of a complaint or a suggestion for improvement in there, nobody sees it. They see the
Yeah.
positive things they're kind of looking for, right?
Yes.
All right. Realize we're at 9 o'clock. I see Rebecca just had to jump off. If you know what, would it be okay for you to share your email actually, Louise?
Yeah, absolutely. You put it in the Dropbox.
Yeah, we'll put the email in the chat here so that if there are any more follow-up questions, that you can follow up directly with Louise. Thank you so much for this presentation. It was really great. I always love learning a little bit more about your work. And I think that our students also appreciate hearing about kind of how you got into this work and are starting to build these collaborations
Yes.
and sustain them. So thank you everyone for joining. As a reminder, again, this was our last Coffee and Conversations for the summer, and we plan to repeat this series again next year. We don't have dates or speakers lined up yet, but we usually promote this with our Global Health Summer Institute. So more details to come for 2025. All right.
Happy
Thanks,
summer,
everyone.
everyone.
Thank you.
Bye.
Have a great day, everyone. Bye-bye.